coronavirus may soon be spending less time in quarantine.
KIMT News 3's Anthony Monzon joins us live with the CDC's updated guidance. Anthony?
Katie, George, tonight the CDC is refining its quarantine guidance, maintaining that while a 14-day quarantine is the best option for reducing the risk of spreading coronavirus, under certain circumstances, that period can be shortened. New analysis from the CDC leading to 2 alternative quarantine periods. Health experts now say those exposed to coronavirus could end their quarantine after just 10 days if they have no symptoms, or 7 days with no symptoms and a negative test result. University of Minnesota's Dr. Michael Osterholm says the change could make it easier for more people to quarantine.
If one is following someone for 7 days versus 14, and then particularly if you have a negative test, that really is likely to have a much more positive impact than people who say, well, I can't do 14 days.
Governor Walz also weighing in on whether the reduced quarantine periods would be effective in Minnesota.
How do we gain compliance while still following the science, reducing the number of infections? So this whole debate about the time period of the quarantine is about that. Germany found out that if you reduced it to 7 days, more people followed it and infection rates went down. Now, the health guidance would tell you you should go to 14 days. Now, what I don't know is, with a high amount of community spread and positivity, does that negate what you would gain by going to 7 days because of the volumes?
And the CDC is also stressing the decision to shorten quarantine periods should be made by health officials in their own respective jurisdictions. Live in Rochester, Anthony Monzon, KIMT News 3.
Thanks, Anthony. The CDC also says a shorter quarantine period can lessen stress on public health systems, especially when new infections are increasing rapidly.